Thank you, Carrie. Thank you all for being here today. Can you hear me okay? Very good. Okay. It's been a personal journey with myself and my son. My son was born with gestational Lyme, which was diagnosed many years later. It took many years and many practitioners, many misdiagnoses, 19 specialists. We nearly lost him a couple times. So between being diagnosed on the spectrum to being diagnosed with chronic tick disorder to being diagnosed with Lyme disease, 11 co-infections that were all in the brain, crossed the blood-brain barrier. And as a blessing, you know, they say the blessing of illness, the gift of illness, the blessing was that I found out that I had Lyme, and all of the chronic fibromyalgia, chronic fatigue, you know, all of those were anxiety, you name it, you know, endocrine disruptions, those were all misdiagnoses. So long story short, 19 co-infections with me, 11 with my son, traveled the world trying to find specialists back then. Dr. Jones, Dr. Klinghardt, Dr. Jemsek, just to name a few. Of course, Dr. Shoemaker, Dr. Shippen from right here in Reading has been my endocrinology mentor for many years. And many of you might know when there's Lyme, there is a lot of endocrine disruptors that come into play, and having a good Lyme literate endocrinologist on board is great. It just worked out that Dr. Shippen, who is now retired, was also Dr. Shoemaker's teacher and mentor. So that worked out both ways with the mold and the Lyme. I'm speaking right now about just about the naturopathic approaches, the herbal approaches. One of my mentors is Stephen Buhner, Julie McIntyre. Spent a week with them in 2017 at their home in Silver City, New Mexico. It was an honor. Amazing experience, inspired me to develop my own line of herbals, which is only for my practice. It's not a company, there's no commercial interest, it's only for my patients. But the organic farm is right here in Lancaster, so I wanted to mention that. So let's proceed. I always begin with giving thanks to my mentors. There's been many along the journey. I would say I'm, about 90% recovered. My son went from being almost nonverbal in a wheelchair at age 6 to right now he is from being nonverbal to being on the honor roll. He is in a pre-med integrated high school. We're looking at med schools. He's a junior. And he's just released an interview actually with Karen Thomas and Naturally Recovering Autism, and it's been received very well. You know, people need the hope about when it comes to Lyme-induced autism, and we know that Lyme mimics many different diagnoses. What I'm going to talk about is why people try naturopathic, why people look at herbs and homeopathy and homotoxicology, and why it's important and what we do in my practice. Now, we know that Lyme disease survives, and we had an amazing lecture by Dr. Bach just before me. It survives intracellular, extracellular matrix. It's been found in body fluids and tissues. And I do have to beg your pardon. I've put in a lot of slides and a lot of information in there because I was told that the slides are being copied as well for the public. The slides are being recorded. So there is a lot of Lyme tonics and recipes and adrenal herbs and diets and hypothyroid herbs, etc. that I use. And I'm going to try to move a little fast since some of the slides are self-explanatory, and I will be following the slides. So those of you who are going back home and watching, and if you have the short-term memory issues that I used to have, it's good to have something in front of you and you can relate. So that's what I'll be doing, and I'm going to try to save some time towards the end for the Q&A if anyone has any questions. So persistence and pathogenicity of Lyme. Lyme exists in many body fluids. It has multiple forms. There's the L form, the cyst form, the blebs and vesicles, the spirochete itself, we all know. We're also dealing with biofilm. That is the reason why Lyme disease persists in spite of conventional treatment, the best doctors. These are some of the mechanisms of persistence. One is, those of you here who are fans of Stephen Buhner's, Stephen talks about bacterial intelligence and how bacteria communicate with each other. Klinghardt speaks about the close relationship between strep and Bartonella. Many of you here may have heard about the BLO, sometimes referred to as the Bartonella-like organism or the Babesia-like organism. So those are facts. Those do happen with many patients, and that is how these tick-borne infections are persistent for many people. I have people that come to me that have done antibiotics for, 6-7 years off and on. They've tried IVIG for their kids. They've tried everything in the book, and it still persists, mostly because it's intracellular, and mostly because, these are the people that would respond to a really good herbal and naturopathic protocol. So the mechanisms would be there is active immune suppression by the bacteria, there is immune evasion, and many of these bacteria, they change their genomic patterns to develop immune tolerance. And last but not the least is physical seclusion. They hide in body compartments that are not patrolled by the immune system. Okay, just a chart version of that explanation. There's active immune suppression, and then there is the immune evasion, and a little bit more examples as to how it happens. Bottom line is it leads to chronic inflammation. Okay, now when somebody comes to me and says, Dr. Dashore, I am not feeling better. Now, what we find is there is underlying, this is a long list, and I do go through all of these with all of my patients that come to me and say they're not getting better. So we look at additional bacterial, parasitic, protozoal, viral infections. The issue with viral infections is nagalase, the enzyme nagalase that is secreted by cancer cells and viral cells as well. And I'll talk a little bit more about that. We look at heavy metals. We look at dental issues, bone cavitations, gingivitis, emotional issues, mitochondrial dysfunction, MCAS or mast cell activation syndrome is what I deal with in my practice, KPU, exposure to mold. I have another lecture this afternoon where I will be discussing chronic inflammatory response syndrome. Many patients that come to me have ongoing exposure to mold, work, home. My son was re-exposed after 5 years of work with Dr. Shoemaker. My son was re-exposed on the school bus, of all places. God bless the school bus driver that gave us the information that the windows leak. So there was, you can imagine, it's cold, it's snowing outside, kids are coming in with boots on, etc. And the heat is on in the bus, and you have the windows leaking. So it becomes like a greenhouse effect for mold to grow. So there can be mold exposure, and these patients, what has been found is if there is underlying mold, it becomes nearly impossible to recover from Lyme and co-infections, or the symptoms are so intermixed, interrelated, that people think that they still have Lyme, but the Lyme has been treated by the years of treatment that they've done, and now it is the chronic inflammation that is the issue. So it's very important to look at mold. Environmental toxins, I look at the diet, if it's organic, non-organic, if they are exposed to BPAs, if they are exposed to any flame retardants. Most of us develop multiple sensitivities. I have EMF sensitivity. My son, it's massive. So electromagnetic fields, any kind of toxins in the environment we become sensitive to. So it's important to look at all of that. One very important aspect to look at is treatment is all well and good. So you've been treated, you've done this, and you've done the most expensive treatments on the planet, but has anybody helped you with repairing the damage that was caused by these infections? We know that there is biochemical issues, we know that there is physiological changes. You can see those in labs. There are many labs you can run, for your gut, for your amino acids, for minerals. There are many depletions that happen in the body because of these illnesses and also because of the medications, the pharmaceutical medications that are taken to help with the infection. So repair is a very important part. I tell all of my patients that, you know, having a great LLMD and having a great naturopathic or holistic practitioner is the best combination you can have. Yeah, we also look at SIBO, we look at methylation pathways, detox, the HLA-DR, the genetics. Most of my protocols are custom tailored to each patient. I have a look at their HLA-DR pattern, I have a look at the methylation pathways, and we try to customize each protocol for each individual patient. That is something that works really well. Okay, the most common co-infections, most of you here might already know this, but these are what I have found in my patients. I mean, you name it, it's been everything, Babesia, Bartonella, all the way down to Epstein-Barr, cytomegalovirus, HHV6 virus, parvo, sometimes toxoplasmosis. Oh, I have it there already. So toxo comes up positive as well. Many of my patients have pets. Many of their pets have Lyme disease. So we have an herbal approach for the pets too. We have herbs for cats, dogs, horses. I'm currently in the process of developing herbal formulas for camels. Now camels, I have to meet with I haven't asked this question to the farmers here in Lancaster, the camel owners in Lancaster, but across the world, I mean, I'm on the scientific advisory board of IFCAM, which is the International Forum for Camel Advocacy and Medicine. And most of the farmers in Australia, in the Middle East, they say that in spite of finding ticks on the camels don't seem to develop any symptoms, which is interesting. You may have heard about, I think it's a lizard, isn't it? And correct me if I'm wrong, in California that has antibodies to Lyme or is not affected by Lyme. And I know that there are some researchers that are looking into what happens. So I'm thinking camel might be, you know, another animal or mammal that we can look at. I'll be speaking a little bit more about camel milk and how that's helped my patients with Lyme that have been on antibiotics and conventional treatments for years with a very bad gut issues. Okay, so when I'm looking at my patients, it's important, like I mentioned a couple seconds ago, to address the three main components of Lyme disease. First of all, you have the actual bacteria. Then you have the illness-producing effects of the toxins that are produced by these bacteria. And then you have the immune responses that are provoked by the toxins and the microbes. Okay, and it is these immune reactions that are quite dependent on the genetics. That is why looking at genetics and coming up with an individualized protocol for each patient sometimes works wonders. Okay, nagalase. Nagalase, it's an enzyme secreted by cancer cells, secreted by cells with intracellular viruses. It degrades the extracellular matrix. It interferes with vitamin D3 absorption. And the GC protein can no longer activate the immune system or the macrophages. The macrophage activating factor is depleted, so it weakens the immune system, in other words. Now remember, we are talking about why are you not getting better. And when you're not getting better, these are the things you need to look at. You need to look at mitochondrial dysfunction, right? We look at, sometimes we run tests, sometimes, you know, symptoms are good enough. Wanted to mention that I work with patients, you know, many of my references you'll see are international, because I work with people in 44 countries. I got someone from Albania a couple days ago. So 44 countries around the world, we Skype, and there is a lot of Lyme disease and mold everywhere, all over the world. Okay. So mitochondrial dysfunction. So we are looking at deficiency in energy, ATP. It leads to muscle weakness, it leads to exhaustion, it leads to fatigue, it leads to swelling, it leads to cardiovascular insufficiency. And you'll see that, most of us who enjoy exercise, you'll see that recovery keeps getting longer. There's also a mold connection to this, exercise recovery, and I'll discuss that in my second lecture. Cryptopyrroluria. We've heard, many of you must have heard, Dietrich Klinghardt speak about KPU. KPU is a fact for many of the patients that come to me. We don't even have to test many of the times because finances are tight. It becomes important to have a practitioner who is well-versed in the full 360. So, and I'm not saying it has to be an ILADS practitioner. I mean, I'm ILADS and Dr. Shoemaker trained, but someone who understands, all of these little pieces to the puzzle, and be a good detective and pull things out that have not been addressed. So we know that KPU is very depleting to the body. It is very uncomfortable. It leads to a significant loss of minerals and white blood cells. So in other words, it weakens your immune system again. All right, maintaining a pH balance. Too much of a good thing is not a good thing. If you're doing green juicing all day, that is not a good thing. I've seen episodes of the oxalic acid and uric acid crystals being forced out of cells. And I have some patients that develop pseudo gout in the knees and they think it is Lyme disease, but it really isn't. And then you find out that, what is your pH? My goodness, it's like 8.2. We need to tone back a little bit on that. So too much of a good thing is not a good thing. I remember back in the day when I was advised for my son, it's been a personal expense and a heavy learning experience. I was advised to give my little guy 1 trillion units of probiotics a day because we had him for the first 6 months because it was life-threatening for him. So for the first 6 months, we had him on 3 or 4 antibiotics along with detoxification, but 1 trillion probiotics a day. And I thought I was doing a really good thing. And we ended up with SIBO. And when I spoke with Alison Seebecker, who is the #1 SIBO expert, she mentioned this to me, and it's been a learning experience. So that SIBO is very hard to get rid of, especially when you've gotten SIBO from good bacteria. That's just because there is an imbalance. So too much of a good thing is not a good thing. All right, so that's about pH balance. Hormonal. Endocrine disruptors are everywhere in our environment. I see patients that come in with issues with all of these hormones: estrogen, progesterone, testosterone, growth hormone, ADH. It's been 3 years since my son has been on growth hormone, because when you're exposed to Lyme, when you're exposed to mold, these hormones completely go off track. I've seen early puberty. I have a 7-year-old little girl, mom's devastated. She's already showing signs of puberty. She's 7, already showing signs of puberty. And then you have little boys whose hormones are not coming through for puberty because of the aromatase upregulation. The testosterone is getting pushed into the estrogen pathway. So you have, you see boys that are developing as sensitives, a little hippie, a little, other signs of estrogen dominance. At one point, my son's estrogen was higher than mine. So that is something we have to look at. It's a very important aspect of recovery. Okay. Genetic mutations I spoke about, yes, they affect your ability to detox. They cause problems with sleep and mood, once again, interfere with immune function. And they are, there's plenty of documentation out there that genetic mutations are associated with many chronic illnesses. And mutations and predispositions. Now, this is followed by a beautiful, very, very simple to understand diagram. Voila. But the most important ones that I look on here, I mean, of course, it's going to vary from patient to patient, but the most important ones that I look at is MTHFR, the A1298, and the 677C, the MTHFR. Just those two alleles is what I look at. And then I also look at the CBS 699, not the other CBSs which might be involved. I mostly look at the CBS 699. I also look at the VDR BSM and the VDR TAC, perhaps a little bit of COMT, but that's about it. The MAOB, etc., those come into play much later, but immediately, right, for immediate detoxification, for looking at, especially for kids that have Lyme-induced PANS or Lyme-induced autism, I look at the serotonin and dopamine balance is what needs to be looked at, because many of them are unnecessarily, they're on antidepressants. They're on SSRIs, and even though the SSRIs are not working, the dosage keeps getting higher and higher. And sometimes with herbs and homeopathics is all they need. And of course, diet modifications to get rid of glutamate and phenols and salicylates. Many adults and kids being more susceptible to these dietary issues. So methylation is very tricky. It can cause a pretty heavy over-methylation reaction, but if you are not methylated properly, I've seen, over-methylation, too much methylation is not pleasant to experience. Sometimes I wait till the very end, till all of the inflammatory cytokines have calmed down, till the mold is all treated and done with, and that is when I will address methylation, unless there is, a major detoxification issue. Okay. This is the natural approach that I use. Of course, the BioNexus approach, we start with the foundational protocol. Now, this is not like, you're not doing step 1 and then step 2 and then step 3. For many patients, we do. For many patients that have the multiple chemical sensitivities, or mast cell activation syndrome, for those people, we need to go one step at a time. We just do step 1, step 2, because they're so sensitive to anything new being introduced. But many times I'm able to do the foundation protocol, and then we wait for labs, and then a week later we go into the GI support, and then we look at the detox support for lymphatic system, kidneys. What are the main detox organs in your body? You have your liver, your lymph, your kidneys, your lungs, and your skin. So often one of the detoxification issues is breakouts all over the body. Heavy-duty cystic acne on the back is what I'll see, other than on the face, depending on age. So we support all of the detoxification organs. Then after that is done, step 4 is looking at the root cause. And the root cause could be Lyme, could be mold, could be co-infections. Then we move on to repair. It is bio-individualized repair. We look at the genetics, and then we come up with an individualized protocol for the patient. We look at regeneration protocol. Now, regeneration protocol is mostly seen for, I use regeneration protocols for neurological Lyme disease. We have herbs that have neuronal growth factors. So those are very helpful for reestablishing those neuronal connections, for helping get rid of the edema and the swelling and the inflammation in the brain, the NMDA receptor activation that comes with PANDAS issues. And number 7 becomes the optimal maintenance and lifestyle choices. Many teenagers, or I guess people of all ages, will ask me, when can I go back to my normal lifestyle? And I say never. Or if by normal you mean eating pizza, drinking beer, eating donuts, drinking coffee all day, that's never going to happen. You've been ill for so long, and these are some of the lifestyle changes that you have to maintain. You need to maintain vigilance. In fact, most of us who are committed to getting better from Lyme disease naturally, we end up being much better for it. We are in our 40s, 50s, 60s, and we probably have, another 30, 40 years to go. And those years should be vibrant, should be beautiful, should be just happy and healthy. Okay. Some of the supporting testing we do, I look for hormonal imbalances, neurotransmitters, mitodysfunction, organic acids testing, mycotoxins, overall tox panel, glyphosate, and methylation. Glyphosate is a big issue. So let's talk about the plant-based protocol. So welcome to the bark side. I couldn't resist, sorry. So wisdom from the botanical realm. So this is a step-by-step approach. This is what we do. Just for herbs, here is a general usage instructions for you. 5 drops is considered a homeopathic dosage. Like herbs, we know, right? You can have tinctures, you can have glycerites, but typically 5 drops is considered to be a homeopathic dosage. 10 drops is a tonification dosage. And 15 drops is a therapeutic dosage or the beginning of a good, robust antimicrobial dosage. Of course, I do have 80% of patients who will just completely start herxing after 2 drops of herbs. That's fine. If you have proper detoxers on board, you can slowly build up. You can start with 1 drop and add in 1 drop every other day. And we just make sure that the herxing is kept minimal. That is all built into the BioNexus protocol. It's important to note that frequency is more important than dosage. So if you are dosing 5 drops once a day versus 1 drop 3 times a day, the 3 times a day becomes more important. So that's the important thing to note with herbs. Then I mentioned you start with 1 drop and build it up. You may mix, like most of my patients, they're like, oh my God, doctor, I have like 22 herbs. The important thing to note is they can all be mixed in together. They can all be mixed in together, and you can make 1 herbal cocktail. You can make all 3 doses and keep it, in the fridge for the rest of the day. I remember making it for everybody in the family and just having these beautiful herbs, sitting for us to take in. Obviously, practitioner guidance is strongly recommended, but there are going to be several protocols here, several tips here that you can get started at home as well. But I do have to say that it's good to have a good herbalist on board. Pennsylvania has wonderful herbalists. My medicine maker, Ben, is absolutely amazing. He's right here in Lancaster. He doesn't see patients, but there are many amazing herbalists in Pennsylvania. A brief important note would be pediatric, right? You divide the weight of the child by 160 to get the exact dosage. So if you have a child who is like 32 pounds, you would divide like 32 by 160. Or if you have a child that's 40 pounds, 40 by 160 is a quarter of the adult dose for this child, of the herbs, of course. Right, so here's the foundation protocol. Remember, we are going step 1, 2, 3, 4, 5, 6, 7. So foundation protocol, I make sure that all the patients get started with, typically while we are waiting for labs, or I have different days for Skyping and I have different days for in-person appointments. In-person appointments are sometimes there's a long waiting list. Unfortunately, all of us Lyme specialists, ILADS practitioners have long waiting lists. So we start off with like a quick Skype where we touch base, we look at all of these things, and we get them started on the foundation protocol, and that's very helpful. It often alleviates fatigue. You start to feel better, and then we wait for the tests. I mail them the test kits, and they have everything sitting right at home. The lab results come back to me, and then we can either Skype again if you are debilitated, or you can come in the office. Especially for things like nasal swab testing and whatnot. But yes, vitamins A, E, K2, D3, C, and the Bs, especially thiamine, Of the Bs, I find B1, B2, B6, and B12 being the most important. These are all associated with things like anorexia, sleep issues, so it's important to have these on board. Antioxidants, good omega fatty acids, trace minerals, magnesium. Magnesium is very, very important to have on board. There are different kinds of magnesiums. There are Facebook groups that deal just with magnesium. So just as a ballpark, ionic magnesium, I typically use ionic for patients with IBS issues, not diagnosed IBS, but I should say, IBS-like issues because of antibiotics or a mold exposure or whatever. So I use magnesium and minerals that are ionic and easily absorbed, and electrolytes as well. Many patients prefer to do Himalayan salt in the morning. Many patients prefer to do just coconut water for the electrolytes. So as natural as possible, we need to reduce the cost for most patients. And most professional supplements are expensive. So the more dietary modifications you can use, the more easily digestible forms. Like for myself, for my breakfast and lunch, I only do smoothies. That's easily digestible, keeps up the energy. So your body's energy is diverted towards repair and not so much towards digestion, because the food is easily digested. Because you're presenting the food to the body that contains everything, what the body needs. So I eat once a day, and that really works well. I mean, for my age, at my age, it's good to keep things low and slow for the digestive system. So that helps with energy. Okay, and of course taking care of my son as well. Amino acids, pH balance, probiotics. For kids with PANS, remember no strep strains in the probiotics. Diet is important. Make sure that you have bile supports on board. You have to make sure that bile is flowing. If you have a patient that is belching, burping, gassy after eating, you just have to make sure that there is enough bile in there. Or some of them that have gone through a cholecystectomy, they don't have gallbladder. Many patients come to me after bicillin shots or some kind of IV antibiotic treatment, and that they had a lot of severe reactions with the gallbladder inflammation, and they had to go through surgery for that. So that's something to have in your mind as well for the foundation protocol. Now, organ support, liver support. Some of the supplements I use are NAC, N-acetylcysteine. That is very helpful in the methylation cycle as well. I find Guna liver, Apohepad to be, these are my favorites. I know there are many out there, but these are my favorites. These are some of the ones that I've found best results with. Again, no affiliation with any companies. This is just tips, just clinical pearls. For kidney support, I found Solidago, Renalix, Kidney Tone, Uva Ursi. Many of my patients have things like Klebsiella, etc. when I do a Marcon's nasal swab for them. And many women have a lot of bladder issues. So these are the supplements and herbs that have been helpful. Lymphatic drainage, Lymphonis comes from Switzerland. Ityrese, Mangista, Cleavers, Dandelion. Adrenal support, I use Eleuthero, Ashwagandha, Loving Energy, Supren from Picana, and Drenotropin. Am I going too fast? You guys okay? Okay. Because I get very intense. I've lived this for so many years, and I just forgive me and raise your hand and say, hey, slow down a bit. I'm okay with that. Okay. Mycotoxins we will delve with in depth this afternoon, but just to give you an idea, of course, cholestyramine, Welchol are the top two. After that, I use Ultra Binder, activated charcoal, Luvos, clay, chlorella, Takasumi Supreme, microchitosan, all of these, depending on which mycotoxin is present in the body. So these are all good for mycotoxins I've seen. Then we have xenobiotics. Any zeolite is fine. There are some zeolites that are better than others. This is what I've found. So Pure Body Cleanse is something I use in my practice a lot. I also use TRS, but TRS Advanced Detox helps with heavy metals as well. So I use IMD Cleanse. Cilantro works great for lead. IMD Cleanse is nanonized microsilica, which works great for overall heavy metal detoxification, including mercury. Of course, chlorella, metal cord, neurocord, and metal pull. These are some of the supplements. Vaccine detox for my autistic clients. And it's interesting because I have such a large international clientele, and a few of them are here in the United States, meaning that, in fact, the clients and their immigration attorney are all my clients, are all my patients. But what happens is when you go for your citizenship, I remember when I went for my citizenship like 25 years ago, they make you take the vaccines again. So I was re-injected with MMR, DTaP. Oh my God, it was heavy toxicity on me. So it becomes important to guide patients, immigrants who are going for their green card interviews, immigrants. When you're going for your green card interview, that is the best time to be prepared, because you will be going for your citizenship soon enough. And it's important to have pre-detoxification or at least a vaccine detox program on board, because adults with underlying Lyme and mold issues will sometimes, often, not just sometimes, often react violently to vaccine exposure. For children that I see, I have a large population of children with autism, with PANS pandas, with Lyme, and with mold. So these are very complex. I literally call it complex autism. Okay, glyphosate detox, GDS blend. GDS blend is just glyphosate detox support. I will speak about some of the blends that I've had to develop because there simply weren't any out there for my patients. Okay, some of my favorite things for gastrointestinal support. Okay, first of all, rotate probiotics. Then if there is mild IBS issues, look at IB Guard, look at anti-inflammatories like curcumin, bile salts, enzymes, proteolytic enzymes. I'm not a big fan of biofilm busting. I take the teachings of my mentor, Stephen Buhner, very seriously when he says, when you're trying to recover everything else that is outside of biofilm, recover that first. Why do you wish to bust the biofilm and release more bacteria? Save that for the last. And that's what I kind of tend to do. It's important to understand the difference between antibiotics and herbs. The herbs, your cells are programmed to recognize food, and they open their channels so the food can come in. Herbs are plants. Your cells recognize them as food. They are able to go intracellular through those channels. Antibiotics are chemicals. They don't go intracellular through the channels. You have to have support on board, like biofilm busters, for example, for the antibiotics to be able to penetrate. Good herbs really penetrate deep and good. So most of the times, I just use mild biofilm busting herbs towards the end, and we are good to go. Gut motility, it's important, if you're detoxing, if you have binders on board, it's important that you're not constipated. It's important to have a good cleanse every day. Okay, essential fatty acids, phospholipids, check for methylation, gentle immune modulation with camel milk therapy, I'll talk about it. Of course, collagen support. These are some of the dietary modifications. I will not go into depth, but it's there for you. Glyphosate is important to look for, make sure, the environmental protection, not EPA, the EWG, Environmental Working Group, has a list of the Dirty Dozen and the Clean 15. As far as fruits and vegetables that are the most sprayed with fertilizers and chemicals and pesticides and herbicides. There are many ways glyphosate gets into our body, but that's a whole other lecture altogether. But these are some of the things to check for. Excuse me. So for children, sometimes for adults with multiple chemical sensitivities, you need to look at sulfites, sulfur, phenol, salicylate sensitivities. These adjusting diet can work miracles sometimes in people. Okay. Enzymes, digestive, proteolytic, coenzymes. So when you're doing enzymes, just remember that you always have coenzyme support on board for the enzymes to work their best. All right. Some of the herbs that I use for female hormonal balance. So for PMS, raspberry leaves, dandelion root, black cohosh, wild yam, alfalfa, nettles, fennel, vervain, these are excellent. Tinctures are preferred, but if you're very sensitive, glycerids is fine. Glycerids would probably need a higher dose. If you're making the herbs yourself at home, keep in mind glycerids take a very long time to make, but they're so worth it. For dysmenorrhea, we use crampbark, yarrow, California poppy, Jamaican dogwood, damiana, motherwort. Sometimes ashwagandha helps as well. For menopausal relief, sage, vitex, black cohosh, rosemary, shatavari, ashwagandha here works really well, and valerian. Okay. Hypothyroid herbs. Okay, so we have lots of them actually. That's why they're all in the PowerPoint. There is gotu kola, there is chickweed, there's sarsaparilla, there's parsley, burdock, ashwagandha. It's important what part of the plant is being used in the herbs, right? And then we look at coleus. I use, I'm trained in Ayurvedic medicine, so I use a lot of Ayurvedic constitutional remedies as well. So we have wild carrot seed, coleus, saffron stamen. These are some of the Ayurvedic remedies that I like to incorporate in my practice. We look at the Vata, the Pitta, and the Kapha constitutional relationships of each patient. I also do a lot of energy medicine, so I would recommend, second chakra cleanse and reset if there are any hypothyroid issues. Okay, these are some tips for hypothyroid nutrition. Yam, sweet potatoes, black beans, parsley, sea veggies, oats, olive oil. Then we move on to adrenals. I'll go a little fast here. I have about 15 minutes left. 10 left, okay. Sure. Now keep in mind these will be available online once the video recording comes out. Okay, so I'll leave this for the online version, right? These are some of the herbs for adrenals: licorice, St. John's wort, ginger, chickweed, aerial pods. Then we have the Australian bush essence. The third and fifth chakra cleanse is associated with adrenals. Nutrition, of course, sleep, fish, flax seeds, and oil, no caffeine. Okay, extracellular matrix and ulcerations. Here is a wonderful recipe with slippery elm and marshmallow. Please access this later on but I've put in a lot of recipes for you. Okay, anti-inflammatory herbs and essential oils that are safe to use with those herbs. Just remember, these are not general essential oils that I have put on there. The herbs listed on top, the cordyceps, red sage, kudzu, etc., that are anti-inflammatory: skullcap, Chinese senega root, tulsi, haritaki. The essential oils are synergistic: the clove, the ravensara, the thyme, the ginger. Of course, curcumin is pretty much synergistic with everything. Okay. These many of you must know already: herbs used for Lyme and co-infections at BioNexus Health. For Lyme, we use astragalus, cat's claw, knotweed, and so on. For Bartonella, it's Houtinia, Sida, Arjuna, Danshen, Tulsi, Redroot, Hawthorn, and so on. And Babesia, we have Bidens, Crypto, Sida, Fenugreek, Triphala, Skullcap. Both the salvias are amazing. And for Ehrlichia anaplasmosis, we use licorice, Isatis, Sida, Danshen, red sage, red root. Remember, they can all be combined to make that herbal cocktail. Okay, these are the specific formulas that I've had to come up with. Formula 1 through 9 is Formula 1 nasal spray, 2 is essential oil blend, 5 is dental health and extra strength, 7 is glyphosate detox, Formula 8 is for emotional help with hurt, heartbroken, and grief, and Formula 9 is inflammation and joint support. These are combinations of herbs for my patient population. So just an outline again that gives information on that, because many patients don't respond well to the antibiotic Marcon spray and whatnot. Okay. So mycoplasma and chlamydia, this is what I use. For viruses, we use the V blend, yeast, candida, immune modulation. For brain and nerve support, we use skullcap, cordyceps kudzu, motherwort, maritime pine bark, Ayurvedically shunk pushpi. Now I'm going to go even faster, I guess, because there's lots of information. These are wonderful recipes. These you can prepare at home. These are easy to do. Okay, for soft tissue injury, sprains and strains, for muscle, for relaxing muscle spasms, like you can't accuse me of not giving you, takeaways. It's all there. You just have to have patience for it to, come out on video. And I made sure that they are also giving PowerPoints to the public, because many of my patients internationally would love to watch this. So this is all but this is just to let you know that this is all in there, okay? So muscle relaxing recipes, we have arthritic pain recipes, herbs for autoimmune disease. Keep in mind, we have we have the amphoterics, we have the alternatives, and we have the immune regulators. This is why it's important to have, an herbalist on board, because there's so much information, and it's very helpful. I've had amazing recoveries in patients. Okay. How to make a good castor oil pack. It's right there. There are many versions. This is from my revered herbal mentor. Fantastic. Okay, some medicinal mushroom powdered blends are available out there. These are some of the ideas that you can incorporate in your diet. Herbs and oils for dyspepsia and indigestion. Keep in mind, again, these are synergistic herbs and oils that I've done the research for you here, that they are safe to use together. Essential oils need precaution, more so than the herbs. Okay, so this is for constipation and for reflux, for acidity, some recipes. This is fantastic for cognitive functions, for improving concentration, memory, and mental energy. There's the oils. There's from day 1 to day 7. This is what you do, and correspondingly, day 1 oil, day 1 herb. And you go on all the way to day 7. Now, second week, if you survived week 1, you can combine. You will. I'm just kidding. I mean, these are all mild herbs, turmeric, reishi, bacopa. Okay. These are antimicrobial essential oils. You can, there are many. Remember to mix with carrier oils. You can rub at the bottom of the feet, the back of the neck. Always do a skin test for anybody. So, even for, not just for children, to make sure that you have usually it's 5 drops of essential oils to 1 tablespoon of carrier oil to avoid the redness or the irritation of skin. I use them right on the tonsils of some of my pandas children, when called for, and they work really well. Lyme defense tea, fantastic herbs if you brew it according to the recipe. There is a chronic tonic which can be used long term. And there is one more here. This is the Lyme prevention tea or extract that you can make on your own. Just follow the directions. And I have a note in there for my patients in New England, Canada, Scotland, Ireland, Baltic states like Lithuania and Latvia, Ukraine and Russia. This needs to be, I recommend that these go from mid-February till snowfall. Sometimes even with the snow, ticks are surviving. Herbs for detox, digestive, respiratory, for urinary detox, for lymphatic detox. Now keep in mind, I'll go back here. Again, I have herbs and oils. These can be used together. These have been researched as safe to use together. And oils are not for ingestion, right? Essential oils are topical application only, roughly speaking, 5 drops to 1 tablespoon of carrier oil for topical only. All right, camel milk, that's the last thing I think. So camel milk, antibodies. Okay, human antibodies, we know that they, compared to camel milk antibodies, right? There are 3 animals that are being researched for cancer and autoimmune diseases. Sharks, llamas, and camels. They produce these nanobodies. Compared to nanobodies, our antibodies are like big tanks. They are expensive, they are huge, and they really cost a lot to manufacture. So camel nanobodies are 1/10 the size. And long story short, they're able to go intracellular much easier. And they go intracellular, and the research shows us that that's how they are very helpful with soothing inflammation, with detoxification, with getting rid of many dietary sensitivities. My son was able to do almonds and peanuts and sesame all over again. It was fantastic. I don't debate between pasteurized and raw. That's your, raw is allowed in Pennsylvania. That's your individual decision. I do have flash pasteurized versus raw protocols for my patients that have immune issues. If you have autism with PANS, you need to be on a monitored protocol of camel milk. This is just a general composition of camel milk. It is very nutritious. It's a superfood. Okay, it is the milk that is closest to breast milk in composition. Very good for those with endocrinopathies. It has lots of insulin, not crazy amounts, but it gives you good insulin support as well. Camel Med Forum, if there are any questions, there are many experts. I'm on the advisory board as well. There's a Facebook group. Anybody can become a member. It's all free. Now, always, I like to, leave with this. If you see a child with an autism-like presentation, just remember, please put tick-borne infections and mold into the play. You might, if you find a good practitioner, you might see complete remission. I've seen complete remission in my practice so much that it's just mind-boggling that how much Lyme and mold can trigger this autoimmune encephalopathy, and the autoimmune encephalopathy often mimics autism spectrum disorders. So, yep, keep your environment clean and never give up. Thank you.
Thank you, Dr. Dashore. We're going to take about 5 minutes, and if anybody has a Q&A, if you have some questions, there was a lot of great information here. I'd like to know where we get camel milk. Really? Yeah, because, in Pittsburgh, is this something that you order online?
Mm-hmm.
I don't think Giant Eagle has camel milk, so. Does anybody have any questions if you wanted to step up to the mic?
Okay, so I guess we have our first question. Camel milk, where to get it from? There are quite a few, I think there's 2 Amish farmers in Pennsylvania, Lancaster, that supply. But if you just Google it, you will see that there are a few, like depending on where you are, you can, or you can join Facebook group, the Camel Med Forum, and post in there, you know, where your geographic location is, and you will get answers. There is Camel Med Association, no, Camel Milk Association. It might be camelmilkassociation.org. That's another place to look for information on camel milk. Research a little bit about the farmer. Research a little bit about flash pasteurized or raw. Okay. Most of the research has been done on raw, but flash pasteurized works just as well. You have to start with like 1 teaspoon and slowly build up to half a cup twice a day. It's expensive. So it is used for medicinal purposes.
Wow.
It's not used for, like, you know, drinking milk all the time.
And I wouldn't think to start with 1 teaspoon either. You know,
1 teaspoon. It has immunoglobulin A, B, C, not C, duh. It has IgA, IgG, IgD as well.
Wow.
In there. So you have to be careful. Often I've had patients with pandas that cannot afford IVIG or don't believe in that because it's a blood product, you know, and the parents, when they hear that it is, from last I heard, it's from 10,000 donors, 1 IVIG solution. So they don't want to go there. So this is what we do with them. You know, we start with like tiny, sometimes even a drop is needed of camel milk. So we start with camel milk, and we use that for immune modulation. It works really well in many, many people.
That's really interesting.
Yeah.
Thank you. We have a question.
Yes, please. I'm wondering about going from antibiotics with a lot of these supports to just herbal. And I want to take the plunge, but it's scary because every time I go off antibiotics, I crash and burn within 24 hours. So when you start your herbal treatment, do you first keep your patients on antibiotics, or do they stop the antibiotics and then start the protocols? And is there a period of time where they are just non-functioning? Like, do I have to stop living life while I transition from antibiotics to an herbal?
Right. First of all, if you've been on antibiotics for a while, you said, right? And every time you crash and burn when you get off them, look into mold.
I have underlying mold.
So that is a classic presentation that there is something else going on underlying, something that's keeping that inflammation going. Many antibiotics are immune modulatory and anti-inflammatory. So just for those 2 functions, you might feel that the antimicrobial function of the antibiotics is active as well for you. So the antimicrobial part of the antibiotic may not be used, and it's affecting the gut and whatnot. So that's what I've seen in my patients, in my personal practice as well. So no, we don't we don't go cold turkey on anything.
Okay.
Everything is weaned off slowly, and yes, life, you have to be pragmatic. Life happens, life needs to go on. Many of the patients are mothers who have to support, you know, the kids, the families, the entire families are affected. So yeah, there's no cold turkey with anything. We just wean them off and start with the herbs.
Okay, thank you.
You're welcome. Thank you.